Back to Australian issues now and catch up with Dr Katie Allen, the federal member for the Victorian seat of Higgins. Good to talk to you again, Katie. Do you ever get sick of hearing about this so-called national cabinet and national plan when we seem to have all states going in different directions anyway?
Well, I think the biggest issue is what are people wanting, and what they want is the end to lockdowns. There's absolutely no doubt in my mind that people want us to move past these rolling lockdowns, these endless restrictions. They want their lives back. And what they're hearing is there is a plan, and the plan is to get vaccinated. We know that the supply issues are being sorted as we speak, with 4 million vaccines now coming from England, 500,000 from Singapore. Pfizer's flowing into the system at a great rate, so that's great news. And now what we need to do is work out, what it takes to get us through this national plan, which is, of course, vaccination and people rolling up their arms to get vaccinated. And then we've got to look at what's at stake if we don't open up. And, of course, that's health, mental health, and, of course, our own prosperity. So those things are big issues that are at stake, and we need to look at all of them together, because I think people are well and truly sick of these rolling lockdowns.
Yeah, indeed. There's no doubt that the vaccination rates to get rid of the need for lockdowns, that's the national plan, that's the way to go. New South Wales is leading that. Now, that's because New South Wales was heading in that direction anyway, but also because there's no choice with this current outbreak. Victoria is following in step as well. Again, because they can't get on top of that outbreak. But we're seeing a lot of recalcitrance from the other states. And what I've really focused on this week has been the alarming language, the misinformation that's been put about by the Queensland Premier Anastasia Palaszczuk. I just want to show a grab from a couple of days ago. We've shown it the last 3 days in a row, but it is very important to show this. This is Anastasia Palaszczuk 2 days ago in Queensland. I'm sorry we don't have it there. Well, Katie Allen, you know what she said. She said the trouble now is kids under 12 can't get vaccinated. She talked up the fear of the Delta strain hurting those kids. You're a paediatrician. You've got a background in this area. Tell us what you think about the facts on this matter and what Anastasia Palaszczuk has said.
Well, I think it's completely irresponsible what she said. In fact, I actually got out on this issue early because I was worried there might be some irresponsible politicisation of our kids. And to be honest, that's just not on. Let's not politicise our kids. There is no vaccine anywhere in the world that's licensed for the under 12s, anywhere in the world. So for her to come out and say those things is completely irresponsible. Now, the Murdoch Children's Research Institute released a report a couple of weeks ago, a very careful, thoughtful report about looking after our kids. And what the report says is, for those people who are parents of kids, teachers of kids, carers of kids, get vaccinated, because that's the best way to support and protect your children, particularly your under 12-year-old children. We don't yet have a vaccine licensed for the under 12s. It is being looked at by the pharmaceutical companies. They are being tested. They have to look at different doses in children. There are different safety issues you have to look at. Children are not little adults. They are individuals that are different from a physiology point of view. So for Anastasia Palaszczuk to say these things is really just scaremongery. And I really am very, very disappointed, because at the end of the day, we know the Doherty report, which has spent months of modelling, using experts from right across Australia in a very, very careful, methodical way, has looked at the modelling and said, in order to get through this, we need to look at 70% and then 80% of over 16-year-old eligible adults getting vaccinated, and that is the pathway out. We started with a plan that was about protecting our most vulnerable, in the over 70s in particular. With the strains that we've had, we've known that the over 70-year-olds have been at most risk of developing really serious outcomes. The point about the vaccination program to begin with was to target those vulnerable older citizens. And we've seen this year that fatalities are plummeting, even in the rates of vaccination we already have compared to last year. The outbreak in Victoria was much more severe from a fatalities point of view than the outbreak here, or outbreak this year in New South Wales.
Yeah, of course, because all the elderly, the vulnerable cohorts have been vaccinated. This is why I think what Anastasia Palaszczuk has done this week is the biggest story this week, when a lot has happened with the pandemic. I just think it is reprehensible and damages our country very, very badly, because the thing here is, by spreading misinformation, firstly, she creates anxiety for children. Secondly, she creates anxiety for their parents. Thirdly, she strengthens the arms of those people who are not doing enough to get our kids back into school, which is where they should be as much as possible around this country. And then on top of that, she's also using this as a possible foil to keep her borders shut longer until there's some dream vaccine for the under 12s. And we can't have state premiers pushing out this sort of misinformation.
Well, I couldn't agree more, Chris. And in fact, I wrote an opinion piece a couple of weeks ago in a bipartisan way with the other paediatrician in the House, Labor MP Mike Freelander. And we wrote a bipartisan piece about the fact the best way to protect your kids is to get vaccinated as a parent or a staff member or a carer. And that's the 20 to 40-year-old age group. Now, the Labor opposition at federal level has actually been very slow to support the vaccination rollout. Some of them have taken an anti-AstraZeneca position, which was very unhelpful. Some of them have taken a slow to support the national vaccine rollout. But one thing that the Queensland Premier has done is she has now activated more leadership from the Labor opposition, where we're seeing some of their leaders now distancing themselves from that, I think, rather silly position. And they're now saying, yes, actually, we understand you've got to get behind the vaccination, we've got to get behind the next national rollout. And we can see now that the majority of premiers are behind that. There are a couple of recalcitrant premiers. I urge them, get behind the plan. We need to work together on this. The virus does not see borders within Australia, and Australians want us to get to the other side. They want us to get there together.
Yeah, nothing's easy about this pandemic management. And just on that bipartisan note also, then there's a lot of Daniel Andrews has done wrong, a lot of people would say, but I think his admission that zero COVID is dead in Victoria now and pushing down that vaccination path, that's the right call by him, and people ought to get right behind him on that, shouldn't they?
Absolutely. I do welcome the fact that Daniel Andrews has now got behind the national plan. He understands that we've got to learn to live with this virus. He's actually lifted some of the restrictions that I don't believe were particularly evidence-based. I think what happens is, a premier is, only focused on the health of the people in Victoria or in Queensland, whichever premier they are, rather than the big picture, which is the health, the well-being and the prosperity of the citizens. Federal government has a much broader remit from that point of view. So I welcome that he's doing that, but I also welcome that he's opened up playgrounds today in Victoria. Great news for parents of young kids. And he is actually easing some of those restrictions, which I think is going to help people, because we really want as many people to get behind the vaccine. And once everyone who's had a chance to have the vaccine has had the vaccine, then we're going to be able to ease those restrictions and get to the other side.
The playgrounds are open in Melbourne, but I hear it's been bucketing down, so you might have to wait till later on the weekend to use them. Thanks for joining us, Katie. I appreciate it.
Great. Thanks so much, Chris.
Katie Allen there, the federal member